Now we discuss about malaria. Malaria related PYQs. Malaria is a disease caused by Plasmodium parasite transmitted by the bite of infected mosquitoes. People who get malaria are typically very sick with high fever, shaking, chills, and flu-like illness. Usually people get malaria by being bitten by an ineffective female Anopheles mosquito. Question: consider the following statements. First one, malaria is caused by the virus named Plasmodium virus. Plasmodium vivax. So first option is incorrect. Malaria is caused by the virus caused by Plasmodium parasite, not the Plasmodium vivax. Plasmodium parasite transmitted the bite of infected mosquito. Next question. With reference to malaria, consider the following statement. It is caused by the bite of the female mosquito whenever it bites the human. The explanation is, it is caused by the bite of the female Anopheles mosquito if the mosquito itself is infected with a malarial parasite. So the statement is incorrect. It is not caused by the bite of female mosquito. It is only caused by the bite of female Anopheles mosquito if the mosquito itself is infected with malarial parasite. Then second statement, gene drive technology can help in controlling malaria. So this statement is correct. Gene drive technology can help in controlling malaria. Gene drive would cause the anti-parasite genetic modification to be preferentially inherited, making it spread more widely among any natural population of mosquitoes. Then third statement is Mosquirix. The malaria vaccine offers protection against all kinds of malarial parasites. Statement 3 also incorrect. Mosquirix, the malaria vaccine, offers no protection against P. vivax malaria. It is prevalent in many countries outside Africa. The next question. Widespread resistance of the malarial parasites to drug like chloroquine has prompted attempts to develop a malarial vaccine to combat malaria. Why is it difficult to develop an effective malaria vaccine? Answer is, malaria does not develop immunity to malaria during natural infection. Description is, it is difficult to develop an effective malaria vaccine because repeated natural infection does not produce detectable resistance to the exoerythrocytic cycle of malaria in man. Important points. Malaria is typically transmitted through the bite of an infected Anopheles mosquito. Infected mosquitoes carry the Plasmodium parasite. When the mosquito bites, the parasite is released into the bloodstream. Different species of Plasmodium, P. vivax, P. malaria, and P. falciparum, are responsible for different types of malaria. Of these, malignant malaria caused by Plasmodium falciparum is the most serious one and can even be fatal. World Malaria Day is celebrated on April 25 by the World Health Organization and several other international organizations. Next question. What is R21 matrix M? Vaccine against malaria developed by Serum Institute of India. R21 matrix MTM is a malaria vaccine developed by University of Oxford and manufactured by Serum Institute of India in collaboration with Novavax. It is an improved version of RTS. RTS is a first malaria vaccine and R21 is a second malaria vaccine. The matrix M component is an adjuvant developed by Novavax to enhance the immune response. The vaccine has shown high efficacy in clinical trials and has been approved for use in several African countries. The WHO approved this vaccine in 2023, making a major step in malaria prevention. Malaria is caused by Plasmodium parasites, with P. falciparum and P. vivax being the most common in humans. It is spread through the bite of female Anopheles mosquitoes. Fever, chills, headache, nausea, muscle pain, and severe complications like organ failure in several severe cases. Malaria is a major public health issue, particularly in Africa, South Asia, and South America. In 2021, WHO reported approximately 247 million malaria cases worldwide. Children under 5 and pregnant women are the highest risk. Next question. Which among the following is the first country in the world to launch the malaria vaccine for children in its routine national immunization service? Answer: Cameroon. Cameroon is the first country in the world to introduce the malaria vaccine for children into its routine national immunization services. Malaria vaccine known as RTS S or S/AS01 RTS-S is the result of over 13 years of research and development. This vaccine aims to reduce the number of malaria cases and death among children, which remains significantly high in many African countries. The rollout of the vaccine in Cameroon marks a significant milestone in global health, particularly in the fight against malaria. Malaria is a life-threatening disease caused by parasites that are transmitted to people through the bites of infected female Anopheles mosquitoes. According to the World Health Organization, malaria is preventable and curable. In 2019, there were an estimated 229 million cases of malaria worldwide. The African region carries a disproportionately high share of the global malaria burden. RTS S/AS01 RTS-S vaccine, also known as Mosquirix, was developed by GlaxoSmithKline in partnership with Path Malaria Vaccine Initiative. It is the first and to date the only vaccine that has demonstrated it can significantly reduce malaria in children. Clinical trials have shown that the vaccine provides partial protection against malaria in young children. Vaccine is given in a series of 4 doses. 3 doses are administered 1 month apart, followed by a 4th dose 18 months later. Global malaria eradication effort. WHO has set a target to reduce global malaria incidence and mortality rates by at least 90% by 2030. Effort to eradicate malaria include the use of insecticide-treated mosquito nets, indoor residual spraying, and anti-malarial medications. The introduction of the RTS-S vaccine represents a significant advancement in these efforts.